So what started out as a normal sports injury in high school, I had like a thigh bruise, wasn't able to walk, and I had to go to an athletic trainer back in high school. And that's when I started to see how impactful the athletic trainer was able to not only get to know my injury, but also me as a person. And so yeah, after seeing like the lifestyle of a PT versus athletic trainer, I chose to pursue physical therapy. And really the turning point for me as I was pursuing it was when I was in college as an aide. I was working with someone who had cancer as well as going to PT. And I was able to see the ups and downs that she was going through as she was working towards her goal. And yeah, I randomly ran into her 6 months later. I wasn't able to see her complete her PT because I left early on, but yeah, just the joy that I saw in her accomplishing her goals was something that showed me that PT was more than just getting people to move. It was being able to connect with them and just be a little part of their story. Yeah, it's a really good question. I think PT surprised me with how much you get to know people's stories. I think there's just so much time and space to be able to hear their stories, and also the flexibility that you have to bring into the room as well. I think it's really just like one size doesn't fit all, and you have to pull from different experiences, either from my life, other people's lives, and ask certain questions to be able to really connect. And so I wasn't, like when I went into PT school, I never expected to be able to have that type of variety of depth or connection that can really be able to help not only their care, but also reaching to their goals. So health fit has always been on my radar, actually. When I graduated school, the cash base I've slowly been exposed to in terms of just seeing the freedom that you get to be able to treat what the patient needs and have the time to do so. Coming out of some insurance-based practices, I experienced for myself how many good PTs there are, but how much time is so needed to be able to get people to where they need to get to. And I think not only like the coworkers and the boss are awesome, but even just seeing the mentality of wanting to really connect with their clients and their patients to get them to be better and also have the time to do so. That's what sold me to want to work at Health Fit. I think what comes to mind initially is just bringing like the positive energy and just the curiosity and always wanting to learn and grow. I think that's something where I love being able to work with other people or other PTs who have a lot of experience, and just wanting to continue to ask questions that will push the team to think more maybe, and just wanting to grow that type of family-like environment. In terms of what I can bring to like the Health Fit community, I think really the big thing is I think I can bring connection and really just getting to know people's stories, and to be able to hopefully help people feel like they're comfortable here and that they're seen and known in a way that may not always be the case in other places. Typical treatment, it would really just be one, let's check in, see how you're doing, how's your week, how's your day. And then two, really just being able to come back to, hey, what is our goal? And then continuing on the treatment, whether it be manual skills, exercises, and just a good time, hopefully. So, yeah.